Okay, this is a look at social welfare policy. And if we define things like social welfare, we can define it in this manner the vast difference in the wealth and income of citizens in the U.S. And the outcome of that raises questions related to why such differences exist and what the appropriate policy should be in order to minimize those differences. And so, most developed nations have implemented social welfare policies, which are an attempt to provide assistance and support to specific groups in society. Now, we can call that a welfare state. There are various gradations of a welfare state. Greece and France and other places are heavily uh, built welfare states, while the United States is less so. And you can see here what the appropriate definition of a welfare state would be. Now, we know that while most developed nations have extensive welfare states, the U.S. welfare state really is and has been until the last couple of years fairly minimal and relatively recent. And it's focused on helping the poor, not merely those below average. Now, many Americans equate social welfare with government money given to the poor. Yet, what we tend to forget is that the bulk of the money that the government gives is not to the poor, but it's to the middle class. It's not uh, it's not to people who are living below the poverty line, and they do that through things like tax breaks and so on and so forth. Now, some benefits like Medicare really do push social welfare way above the poverty line because benefits like Medicare may be provided regardless of financial need, and these are called entitlements. So there is no means testing, and there is no means testing for entitlements. And what we mean by means testing is that things like food stamps require you to make up to but not over a certain amount of money. And those who are in particular need to meet the specific eligibility criteria in order to get things like food stamps. Now, these things are determined as a part of the political process where some interests are represented more than others. Certainly, we've swung back and forth. We seem to be now bringing a lot more people on who may not quite need government entitlements, whereas in the 1990s he went the other way and cut many people off who had been on entitlements for a couple of generations. Now, we do know that the government poverty line in 2012 was about $23,000, about $11 an hour for a family of four. It's not a lot of money. It's better than $5.50 an hour, but certainly it's not a lot of money. And we do know that for a single adult, the poverty line is set at $11,170. And we know that the percentage of people below the poverty line increased or has increased in the last 10 of 12 years in which measurements have been taken. And in 2011 was nearly 16% of the population. As you can see here, we can see that for those who are uh, under the between the ages of 18 and 64 um, has been uh, has been very good. It's been even better for those over the age of 64, whereas the ones under the age of 18 have experienced the most steady time spent in poverty more than anybody else. Now, unfortunately, things being what they are, we can say that a disproportionate percentage of children are in poverty. In 2011, almost 1 in 5 children were living in poverty. And the poverty numbers really do show more in the way of minorities um, and children living in poverty than any other groups. And part of the reason is a cycle that simply, it's like the cat chasing its tail. There's so many children born in poverty, and they're born to unmarried mothers who then perpetuate the cycle maybe 2 times, maybe 3 times, maybe 4 times. And then their children perpetuate that cycle again. Children having children having children. And so when we look at the 2012 data for children born out of wedlock, approximately a little less than 1 out of 3 whites were born out of wedlock, a little over half of all Hispanics were born out of wedlock, and almost 3/4 of all blacks were born out of wedlock. That means uh, born to mothers who were not married to the sperm donor. So we look at it overall, the overall numbers, 40% of American children are born to unmarried parents or born out of wedlock. Now, some say, well, we need to remedy this. If you lift people up out of poverty, then they will act differently. And there doesn't seem to be a real long-term or deep basis for this thought. I think it's liberals wishing that this was true, because if that was so, then Section 8 would have had a extraordinary effect on how people live, and frankly, it obviously doesn't. So we have the concept of income distribution. And income distribution is described as the share of national income that the top fifth, the second fifth, the third fifth, the fourth fifth, the fifth fifth get. Or it can be looked at through the earnings of various types of groups. It can be ethnic, they can be young versus old, so by age or whatever. But we do know that the distribution of income across segments of American society is uneven. And the income is the amount of money collected between any 2 points in time. So it can be a week, it can be a month, it can be a year. And the government looks at wealth as being things that you already own: stocks, banks, cars, houses. So when you add wealth in, inequality even gets greater than just that which is inspired by income. So we look at the Census Bureau statistics, and they say that the American median income, family income in 2009 was approximately $50,303. For 2009, a family of 3 was defined as falling below the poverty level if it had an annual income below $18,310. Last year, 13.3% of all Americans were living in poverty at that level. Now, obviously, that doesn't tell the whole story. Statistics can say this, but living in poverty in New York City versus living in poverty in rural Alabama can mean 2 very different things. Now, we do know that poverty in America is concentrated among a few groups. Large percentages of some groups are poor: African Americans, Hispanics, unmarried women, inner city residents. Those are the 4 big ones. And because of the high incidence of poverty occurring among unmarried mothers and their children, experts on poverty often describe the problem today as the feminization of poverty. And then they go ahead and they continue the cycle without breaking it. Now, the richest 1% of U.S. households had a net worth that was 25% higher, 225 times higher, than the average American household in 2009. The average family's net worth plunged 41% to just $62,200 from 2007 to 2009. That was because of the housing crisis and the foreclosure crisis in that time period. As of 2009, the wealth of the top 400 Americans is greater than the wealth of the bottom 150 million Americans. In 2007, CEO pay was about 270 times more than the average worker. As recently as 1989, CEOs earned only 71 times more than the average worker. And of course, within that, some make more, some make less. Private equity and hedge fund managers made an average of $657 million for a year, or 16,000 times the average worker. And we can see that in between 2 distinct time periods, that incomes have risen and fallen. So prior to 1933, the share of total U.S. income earned by the top 1% was very, very high. Then it fell especially because of high taxation from between 1933 and 1983. And then with the beginning of supply side tax cuts in the middle 1980s, the amount of money, the amount of income earned by the top 1% was back on the rise to the point where it became much higher in the early part of the decade of um, following 9/11. Now, here too, within the same time period, we see that the bottom second, middle, and fourth fifths have all lost ground. The top fifth has gained ground when it comes to wealth, and the top 1% has really gained a lot. But there's also been tremendous opportunity to do so. The top 1% might exhibit the rise of the dot-com millionaires, or that dot-com generation, starting in the 1980s to the present, while the others are exacerbated by the collapse of in many areas manufacturing and things like that. Now, additionally, the payroll tax is not taken out for incomes over 100,000. Someone making 100,000 pays the same payroll tax as a person who makes 1 million. Now, the estate tax is a tax paid when a wealthy person passes on a large amount of wealth to an heir. And that has also changed to benefit the rich. But it's changed in a lot of countries, and not just the United States. The amount of wealth that is exempt has gone up, and the rate of taxation has gone down. In 2011, you could inherit up to $5 million without paying taxes on it. This applies to less than 2% of the population. I wish I was one of those people. The estate tax is also known as the death tax and is one of the taxes that Republicans would like to eliminate entirely. And I totally agree with them. If I want to give my money away, I don't need the government to do it. I could set up a foundation and do it myself. And many, many, many people do. Now, the government, believe it or not, spends $1 out of every $3 in the American economy, and therefore has had a major impact on citizens' wealth and income. In particular, there are two ways in which the government can affect a person's income. The first way is to manipulate income through taxing powers. So the higher or the more money you make, the higher taxes you pay. And it can affect income through its expenditure policies uh, by, by the amount and the way money is spent. Now, the government spending policies can also affect your income, my income, anyone's income. There can be benefits which are called transfer payments because they transfer money from the general treasury, money that I paid in, to those in specific need. If they really need it, I don't have a problem with that. Government can also give an in-kind payment, something with cash value that is not cash itself. So, for instance, food stamps, or a low-interest loan for college, or healthcare subsidies for poor families with children. So, what we look at when we look at things historically is that for centuries society considered family welfare to be a private concern. But with changes made in the 18th and 19th centuries, with the growth of large cities and the requirements of the urban workforce, the government has felt compelled and impelled to take a more active role in social welfare support. And this really changes during the Great Depression, 1933 onwards. When we look at social welfare in a very different way as we emerge from that event. So, after the onset of the Depression in 1929, many Americans began to think that governments must do more to protect their citizens against economic downturns, provide a safety net. And the federal government responded to this need by passing the Social Security Act of 1935, which was the first time that legislation like this had ever been passed by an American Congress. Now, there other programs come along. Medicare comes along in 1964, 65, somewhere in the Johnson administration. And these were all under the guise of what was known as the Great Society programs. These programs that were supposed to help the poor and the elderly essentially wipe out poverty as we know it. And unfortunately, it may have lowered the amount or the percentage of poverty by 3 or 4 points, but that's about it. So, what the federal programs were supposed to do was to create economic opportunities for those at the lower levels of the economy. And they were supposed to reduce discrimination against minorities, hence affirmative action and things like that. And these were established in the presidency of Lyndon Johnson. These are known as the Great Society programs. And again, they haven't come close to achieving, except for maybe Medicare, well, what Johnson felt that they should achieve when they were signed, when he signed these bills. Now, in the 1980s, in a matter of maybe 15 years, there was a very big common belief that welfare programs had failed. And yet, many of these programs had developed constituencies, so they were perpetuated even when they weren't working. So President Reagan decided that he was going to target poverty programs as a major way to cut government spending. And the choice to target these poverty programs served his ideological beliefs that less government was better, more self-sufficiency was better, and he hoped to change the trail that America had found itself on the previous 3 decades. Now, President Clinton and the Republican Congress enacted welfare reform in 1996. They call it the Personal Responsibility and Work Opportunity Reconciliation Act. We'll just call it the Welfare Reform Act of 1996. Now, this was the third time around. Clinton had previously vetoed 2 very similar bills, but by 1996 he really was boxed in the corner. And when he signed the bill, he called it the end of welfare as we know it. And the major changes were fairly significant. Instead of being a categorical grant, welfare now became a block grant, and that gave the states more power to deal with the poor. Secondly, the aid to families with dependent children, what had been known previously when I was growing up as the AFDC, had now become the Temporary Assistance to Needy Families. Quote, or emphasis on the word temporary. Now, single moms were told that they had to find work in 2 years or risk losing benefits. And unmarried teen moms would have to live with their parents and attend school. And unmarried moms must provide info on the father. And non-citizens and felons couldn't get benefits. And if you didn't have children, you had less access to food stamps. And there was a 5-year lifetime limit on benefits. So you couldn't collect them after you reached that magic 60 months. So when we step back and we look at welfare, we have to recognize that there is no program called welfare in America. What we commonly call welfare refers to several different programs designed to help people meet certain needs. First and foremost, many of you have been in the stores, you've seen the WIC advertisement of perhaps milk or something like that. WIC stands for Women, Infants, and Children. It's supposed to provide low-income moms with things like milk and juice and eggs and fruit, things that are supposedly healthy. And then you have added to that food stamps, which are vouchers to purchase any kind of food. Now, formerly they were paper stamps. They now, for the most part, use a debit card. And the program is called SNAP. Now, Medicaid is also a welfare program. It's a joint federal-state program to provide a minimum level of medical care to low-income people. And so when I said today that if you know of the medical center out on 60th West by the prison, That is a typical Medicaid facility. There are no emergency services, and you're there. If you're there in a day or night, you are going to wait because this type of medical presence is rationed. And the program most closely associated with welfare is called TAMP, or Temporary Assistance to Needy Families. Now, in 2009, about 4 million Americans out of 310 million received uh, um, temporary assistance to needy family funding, and that was mostly children who did that. So it's not a huge amount, but unfortunately, for a rich country, it's more than we'd like to see. Because TAMP is state administered, there's not one set of qualifications that they have to be met. The standard in California is pretty low, whereas in other states, it can be pretty high. In some states, job training or college classes count toward work hours. In other states, they don't. In Massachusetts, TAMP recipients have to work at least 20 hours a week to keep getting benefits. In Wisconsin, they have to work 40 hours a week. Now, welfare reform exists, but we do know that in the 10 years, 1996 to 2005, welfare recipients dropped 60%. And the average income for those who left was about $14,000 per year. One third timed out without finding jobs because they didn't have the job skills. Now we can see that the temporary assistance to needy families lifts many people out of poverty, but when you compare it to programs that were in place in the past, like AFDC, AFDC helped a wider range of people, including the poor. Now we see what happened in 2007, 2009. Those receiving welfare remained rather constant, but those getting help through the SNAP programs and getting unemployment pay soared. And yet, still, all that money being spent comprises less than 5% of the budget. Now, again, in the social welfare policy arena, just like in the healthcare policy arena and the environmental policy arena, the competing groups are often quite unequal in terms of political resources. There's rich groups and there's poor groups. So we know that the elderly are well organized through organizations like AARP and often have resources needed to wield significant influence and support, or in support of programs that they desire. So as a result, the elderly are usually successful in protecting and expanding their programs. For the poor, influencing political decisions is much more difficult, primarily because they lack money. They also vote less frequently, and they lack the ability to develop a strong organization to rally like-minded people behind them. Now we know that the government benefits are difficult to enact, and that being true, then it's also in the nature of democratic politics, which makes it difficult to withdraw something once it's given to people. They always want it, even when they sense that it doesn't work, like Head Start. There are tremendous pressures exerted on Congress and on the executive branch to keep or expand programs, even when they don't work. These pressures persist even when the size and cost of the program seem to have grown beyond anything anyone might have originally visioned. And again, they don't work.